If your child is having trouble pooping, it's probably a basic case of constipation. There's no simple definition of normal bowel activity in children, but there are 3 stages when they're most likely to have problems with constipation. In infants, when you first begin the switch from formula to solid foods. In toddlers, when toilet training first begins. In older children, around the time they start school. As a parent, there are signs of constipation to watch out for and things you can do to help your little one find relief. Hi, Joshua here. What's your name? Well, I can't really hear it. Just comment it down below under the video given to you by the Stomach Health Channel. Let's get on with your stomach. Know the signs your child may be constipated if they're having any of these symptoms. Abdominal pain, fewer than 3 bowel movements per week for children. And for babies, no bowel movement for 2 or 3 days more than usual. Your child attempts to hold in their stool. Signs include making faces, crossing their legs, or twisting their body. Hard, dry stools that don't pass easily, stains and small stool marks in your child's underwear causes. There are many things that can cause your child to become constipated. Some of the most common are withholding. Your child may ignore the urge to have a bowel movement because they're too busy playing to stop and go, or may not be comfortable using a public restroom. They may fear a painful bowel movement or have issues with potty training. Low dietary fiber. Fiber keeps the bowels moving, but many kids don't eat enough fruits, vegetables, and grains. Not enough fluids. Water and other liquids help fiber do its job. Medications. Certain medicines, including pain medicines and antacids, can cause constipation in kids. Remedies to try at home. There are several remedies you can try at home to manage your child's constipation. Make sure your child is getting enough fluids. Most kids need about 3 to 4 glasses of water every day. Add more fiber to your child's diet. Make sure they're eating enough fruits, grains, and vegetables. Fiber keeps things moving. Make sure your child isn't overdoing fast food and junk food. They slow down digestion. Limit sodas and tea. They have lots of caffeine in them. Get your child into the habit of regular bowel movements. Have them try for at least 10 minutes 2 times a day. After a meal is a good time. If these things don't seem to do the trick, talk to your child's doctor about using a mild, child-friendly laxative or stool softener. Well, what do you think about these? Have you experienced this or tried some? Comment down below your experiences. And if you think these are useful, a like and subscribe would be really awesome for the growth of my channel. And also, don't forget about the bell icon below. Let's get it on. When to see the doctor? Constipation isn't usually something to worry about in children, but it can sometimes be a sign of a more serious condition. If your child's constipation lasts for more than 2 weeks, something else may be going on. Make an appointment with your pediatrician if you see swelling in the abdomen, weight loss, stool that contains blood, fever, vomiting, tears in the skin around the anus. If your child's constipation is severe, your pediatrician may want to do some tests to figure out what's causing the problem. They may want to try Abdominal X-Ray. This is a normal X-ray to check for blockage. It is most commonly used to diagnose constipation. Barium enema X-ray. The bottles are coated with a dye so that any problems in the rectum, the colon, or the small intestine will clearly be seen on an X-ray. This is not commonly performed. Rectal Biopsy. A very small tissue sample is taken to check for abnormal nerve cells in the rectum. There is rarely a need for this procedure. Remember, there are many reasons your child may experience occasional constipation. It's usually nothing to worry about. With a few adjustments, your child should be back to normal again in no time. Well, if you have constipation, I may suggest that you take Miralax. It's not sponsored or anything. I just have an affiliate link here. Meaning that if you buy Miralax with the link I put out in the comments or description, I earn a percentage. Miralax is a constipation relief medicine that doesn't cause any side effects. It works instantly. Just look at the 16,500 5-star ratings on Amazon. You don't need to ingest it directly. You can put it on anything: water, juice, food, etc. And this version of Miralax has 4 to 5 doses on each pack. What do you think about these information? Do you think it's useful? If it is, support this channel by giving it a like and subscribe. And also don't forget to click the notification bell for more interesting facts like these.